Good morning and welcome to this presentation on accreditation and change in the Cattaraugus County Health Department. And the subtitle on this is Where Do I Fit In? So this presentation is designed for all employees in the health department to give them a bit of a background on our accreditation process for the Public Health Accreditation Board. This is a very conceptual presentation. One of the points I want to make, and I'm going to stress it here even at the beginning of the presentation, is accreditation is not about gathering documents, uploading them to a website so that we can prove that we've done what accreditation bodies want us to do. That is not accreditation. Accreditation is about adopting a culture of change that looks towards established standards and measures and does our best to continuously and consciously move towards meeting those standards and measures. In an ideal world, accreditation should not be handled by a group of 6 people over a span of 6 months as we gather documents and try to figure out how we're going to get what we need for accreditation. Accreditation is continuous. It is conscious. We need to know what we're doing and where we are heading. Okay? At the end of this change in culture, every 5 years when we need to provide our documentation, it should be a breeze. We should have it in place and we should be able to just grab it and go. It should not be hard. We are undertaking that process of change now. So to begin that process of change, employees need to have a little bit of understanding about the basis for accreditation, and that's what this presentation is about. So you may have heard of the Public Health Accreditation Board, or FAB. And FAB has what they call foundational public health areas. Okay, and they call them services here. It's interesting. One thing you'll find through this presentation is problems with language, right? No language has been decided upon amongst all agencies. So you're going to get some issues with regards to the terms people use. But the important thing is not the terms necessarily, it's the concepts. So I don't care what you call them. I just want you to understand the concepts. So FAB calls these foundational public health areas. And you can see communicable disease control, that sounds familiar, chronic disease, injury prevention, environmental health. Oh, look at that. That is a New York State core public health service for our Article 6 funding. For those of you who don't know, we get a bunch of money from New York State every year to run our programs in these areas. Okay. Chronic disease prevention, that matches up nicely. And those are called New York State core public health services, by the way. Environmental health, that sounds familiar. Maternal, child, and family health, that sounds familiar. Access to and linkage with clinical care, that doesn't sound familiar. That is something that might get addressed through the CHA and CHIP process, and we'll talk about that. CHA is Community Health Assessment, CHIP is Community Health Improvement Plan. It might get addressed through those. FAB also calls these community-specific services, okay? And then you have public health emergency preparedness that is also a New York State core public health service. And you'll see in a minute that FAB calls that something else, gives it a different term. But essentially it works across all these other areas. So what's interesting about this? Well, what about the lab? What about home care? Those aren't listed here. And true, they're not. And they are not considered core public health services. A lot of counties in the state do not have labs. They do not have home care. FAB does not consider these foundational public health areas. When FAB comes in and looks at our accreditation documents, they don't want to know about the lab for the most part. They don't want to know about home care. They don't consider that part of their purview, so to speak. So that doesn't mean that the processes and the things going on in the lab and home care, I mean, home care is a huge part of our health department, shouldn't be thinking about some of these processes and some of these improvement processes moving forward. They should, okay? You'll see here in a moment that what we're doing can apply to a number. The general concepts can apply across organizations. It's not just for health departments. So this is what we do. These are our services, right? I just went through these, okay? This is what we need to do it. We need to be, and notice that these are nouns, by the way. Assessment and surveillance, we need that. We need a community partnership development. We need equity. We need organizational competency. All of these things on the bottom, right? These are what we need. Notice here that FAB says emergency preparedness and response is not a service. It is a capability. Okay, tomato, tomato, right? It's important. That's the key concept. FAB calls these things capabilities, okay? So we have areas that we operate. We need to have capabilities within those areas, and these are the capabilities, okay? There are the areas again. There are the capabilities again. Ooh, what is this? Some of you may have seen this before. These are activities or tasks. Okay, the CDC, who came up with this circle here, calls these essential public health services. Again, language, right? Oh, geez, these are services and we got community-specific services. What's the difference? Listen, these are really the tasks. These are verbs, okay? These are nouns. These are verbs. This is what we do to give us the capabilities so we can do our services, all right? So, guess what? I bet you anybody watching this video can find where their job fits or where different parts of their job fit. Some of you communicate to inform and educate. Some of you investigate, diagnose. Some of you assess and monitor population health. Some strengthen and support communities and partnerships. Okay, some work internally to build and maintain strong organizational infrastructure. Some work, we probably at least got a couple folks that build a diverse skilled workforce. Some improve and innovate through evaluation. Your job may have functions or tasks associated with a lot of these different parts of the wheel. Okay? So, these are what we do on a daily basis. Okay? They're the activities. They feed in and make us capable of, again, here are our capabilities, doing the services that we do. Okay? Not really hard to think about, right? We do our daily works to give the agencies the capabilities to perform the services that we do. Okay? The lab, the home care folks, they do their daily activities to give them capabilities. And look at these capabilities, even if you're the lab or even if you're home care, right? These capabilities here still work, right? Most of these are still important capabilities for both the lab and home care. And then they give us the services or the areas that we do, okay? Aha, so this is directly from FAB, right? The Public Health Accreditation Board. And it shows what we call alignment, right? So it goes from activities, we just discussed this, to foundational capabilities, to foundational areas. Now I want you to notice something here. I'm not real happy with this, but I'm not in charge. Notice that the foundational areas repeat themselves through all of this, right? Basically, what that is saying is that all of the services require these capabilities. And remember, I just said on the previous slide that you could probably also say the lab and home care require those capabilities, okay? So do you really need this level? I don't know, right? I mean, if you're going to repeat it for each service or each set of tasks, I should say. I don't want to call these services. I want to call these activities. If you're going to repeat it for each of these, do you really need it? I don't know, 6 of one, half a dozen of the other. But there you go. So let's go to this wheel for a minute. So we've just discussed, I just discussed again, this idea of our daily tasks, create our capabilities that allow us to deliver our services. Okay. So let's go. This is from the CDC again. This is those groups of tasks, right? And with the most recent version of the accreditation standards and measures, those sets of tasks have been grouped into different domains for public health accreditation board standards and measures. So, domain 1 looks at assessing and monitoring population health. So there's a set of standards and measures in FAB that look at these tasks that we do. Similarly for domain 2, right? Investigate, diagnose, address health hazards and root causes. There's a set of tasks and measures that looks at that. I want to move over here for a minute. There's also a set of measures that have to do with build and maintain strong organizational infrastructure for public health. I'm going to talk about this in a second, but this is internal, right? This happens within our department. This is external, right? We're assessing and monitoring population health. Yeah, we're doing the work, but we're not looking at ourselves. We're looking outside of ourselves. Build and maintain a strong organizational infrastructure. We're looking at ourselves and doing work about ourselves. So these are sort of support stuff on this side, and this is reaching out and doing services on this side. So you're going to find 5 key capabilities. These are all foundational capabilities, okay? And the CHA stands for Community Health Assessment. That's about assessing and monitoring population health. The CHIP is a plan to improve population health. We do that with partners. I'll show you that in a second. Those are external. The Workforce Development Plan, that's looking at internally at developing our workforce, looking at quality and quantity of our employees to get the job done, right? So we have a plan to do that. PMQI, performance measurement and quality improvement. This is, again, internal. This is a process we have to look to make sure we're getting things done. Different programs may do that differently. That may be something in terms of measuring performance, right? I'll talk about that in a little bit, but remember where funding comes from, I guess, and remember those service areas. The strategic plan that looks at internally looks at how we as a department can improve ourselves, right? These are all activities. These are things we do. Look at all of these. These are all verbs, right? So these are things we do on a regular basis. Okay, I mentioned this a little earlier. This is kind of the internal side, right? This is looking at ourselves. This is looking outside ourselves. Why are they clouds, right? Because clouds kind of mix together and don't quite um, have borders to them, and the borders, kind of overlap each other and what have you. It isn't perfect, right? But essentially, the domains on the one side are external. It's looking externally. It's providing our services, and the ones internal are support things that we do. Okay, that's a good background. All right, or at least I think it is. That's a decent background on how accreditation in those domains. Right, we talked about domains on the previous slide. How those domains and meeting those domains help us to think about changing our processes, policies, and procedures to move towards these measures and standards. Okay. Quick key concept on the local health system. Okay. It's not the health department, right? It's a lot of agencies that do health. Um, Google social determinants of health, you'll figure it out, right? But it's a lot of agencies. Ours is the local public health agency, but we also have a home health care and we also have laboratories. I mentioned those earlier, right? I said these are different. These aren't part of the definition of public health, so to speak, right? They're important. Nobody's arguing that point. Um, they are part of the local health system, absolutely. Um, but they have different roles to play. Okay. And so some of their drivers, right, for the home health care and the laboratories, they're going to come from a different place. They're going to come more internally, or they may come from agencies that regulate home health care or laboratory um, work, right? So they have different drivers. Important to remember that. They can still use the processes that we're talking about, but they have different drivers. So key concepts here. So organizational development. I talked a little bit about this. I showed you the internal versus the external. Well, here are the things on the organizational side. Here we're looking at the organization and we're looking at program measures, things that we do at the program level, right? So we do action plans at the program level. And we might contribute to the strategic plan. And that may not be the strategic plan of their department, right? I mean, home health care may have their own strategic plan-ish, right? And our core Article 6 funding, a lot of their planning, a lot of the things that they're mandated to do, so environmental health, communicable disease, right? The, you know, the opportunity for our staff to input into those strategic plans would be talking to their state folks, right? And that's how that works. Um, workforce development, performance management, quality improvement, organizational awareness, right? All of that is internal stuff. This is external stuff. This is our community development. This is multi-organization, right? The awareness comes with the CHA part of things and data development and surveillance, right? Communication, we're externally communicating. Collaborative plan development. This is our role in developing the chip, right? Equitable regulatory enforcement, right? This is how, and it's mostly environmental health, but it's how we interact with the regulated community, okay, and how we deal with that. So again, you got this internal versus this external, making that distinction here. All right, so let's talk about, and I don't know if this is the right term for it, but let's talk about the funnel of health. Okay, so what is this? So notice where staff is, and notice where divisions are. So this would be, the division managers, program managers. Staff is down here. Guess what, staff? Everything sits on your shoulders. I think you guys probably knew that, but I'm reinforcing that. You do know that. Everything sits on your shoulders, right? The work stops with you, the day-to-day work. Okay, you're down here, you're supporting this incredible weight. All right, don't worry about it. We all know you're doing the best you can, but you really are the backbone to all of this. So let's talk about how all of this works. I'm going to introduce this concept by looking at one flow. What do I mean by flow? One way that priorities establish themselves, okay? And I'll talk about the other two in a minute. So you have the CHA, Community Health Assessment. We look at our community. So based on looking at the community, the local health system, not the Cattaraugus County Health Department, the local health system develops a chip to address the data in the findings in the CHA. Okay. New York State has some guidance on how they like that CHA and that chip to occur. New York State looks at that CHA and that chip and improves them. There needs to be a connection between the two, right? I looked at data, I figured out what to do, right? That's the chip. They like it attached to, they like it aligned with, alignment is a term that you should get used to. They like it aligned with the New York State prevention agenda, which is what the state is working on for health. So you have the chip, okay? So the chip informs the strategic plan, right? So the Cattaraugus County Health Department is one entity in the local health system. There are things that we have to do for the chip. There are things that we are assigned to do. Those things go into our strategic plan. Okay. What else could oh, shoot. All right, we'll keep talking. So once the strategic plan is in place and we have goals and SMART objectives, then we develop the action plan. What are the tasks that actually need to occur? What is the plan to get the goals and measurable objectives in the strategic plan done? Those job tasks get performed by staff. When those tasks are formed, or when those tasks are complete, the action plan becomes complete. The strategic plan, or at least those goals and measurable objectives in the strategic plan, become complete. Okay, and we assume that some of those are community health improvement plan goals and objectives, and we assume that with the completion of all of these job tasks, completion of the action plan, completion of the certain objectives and the strategic plan that lead to objectives in the community health improvement plan, we assume that we're making progress in the community. Aha! If you remember one of the first slides, we talked about a lot of this coming from the New York State Department of Health core functions. Okay, do you remember that first? I believe it was the first or second slide that showed that, right? That a lot of this is New York State Department of Health core functions. If that's the case, New York State does all of this planning, right? You don't, they kind of tell you what to do. They kind of tell you, okay, I expect if you're environmental health, I expect all your inspections to get done, right? And done in this way and done on time or what have you. I worked in environmental health, so I'm most familiar with that. But I imagine in the other programs, communicable disease and chronic health, there are core functions that New York State wants you to do. In home care, remember, and lab, you guys are a little different. You're getting some of your direction. In home care, you're kind of getting it from your regulatory agency. Those are some drivers, but you might be generating it internally. There's certainly some profit motive there. You guys need to make money to stay in business and figure out how to do that. And you have goals and measurable objectives to do that, right? So there are three ways that things can come into the strategic plan, right? They can come from the CHIP route. They can come from New York State Department of Health route. They can come from the internal route. Okay. Well, we have documents and systems for performance management and quality improvement. Accreditation asks for that, and that looks at making sure our action plans are done. Monitoring our action plans, making sure they're complete, and that if they're not complete, that we have a feedback process that can improve on the way we do things, and that's the quality improvement process. And that happens down here at the action plan level, looking at tasks. Then you have the workforce development plan, which is to provide our staff with the training and motivation they need to do their jobs in accordance with the action plans. Okay. And so all of that works together. We have a strategic plan, we have a CHIP, and I showed you these before on earlier slides. We have performance management, quality improvement, we have workforce development. Okay. All of this works together. Accreditation is about getting all of this to work together, understanding all of this, and making sure the systems are in place to manage all of this. Most folks in our department work down here, okay, on the division and program level, right? Some of us work up on the next level, okay? Our division managers are going to be taking those inputs, whether they be from the CHIP, whether they be from the New York State Department of Health, or whether they're generated internally to a program like healthcare. They're going to work up here. They're going to develop the strategies to move forward on the actions, right? We really work in these areas, okay? We do not, maybe Doc and a couple of other folks up on top of the food chain are working up here, okay? But most of us are working down here. We are looking for this alignment, making sure this works together. Up at the top, we're measuring the information about our population measures. At the bottom, we're looking at measures about our program. So, quick example, right? Obesity, right? We want fewer obese people. Our goal is, our SMART objective is to reduce the number of obese people in Cattaraugus County by 10% by the year 2025. All right, that's our SMART objective. By the way, SMART stands for, I'm going to forget this. The M is measurable. The T is timely. There's got to be timely. The R is relevant. The A is applicable. And S stands for, oh shoot, I don't know. Look it up. SMART, right? It's easy. But those are going to be down here at so that's a SMART objective for a population. What's a SMART objective for a program? Well, a SMART objective for a program might be by the year 2025, we will have a 10% improvement in the number of clients to our program that say we are treating them well. Right? We do a little survey. It's a 2-question survey. By the way, client survey shouldn't be more than 2 or 3 questions. It's a 2 or 3 question survey. One of the questions is, are we treating you well? Okay. We want to improve that number by 10% in 2 years, right? That's a SMART objective, right? But that's a program objective, right? We assume that is not a population objective. All right. I'm going to quickly, because it's a good example, I'm going to quickly introduce VMSG. VMSG is a software that helps for performance management. It stands for Vision, Mission, Services, Goals. It's a planning and implementation framework for accreditation, right? I'm going to show you how VMSG is used based on everything you've just learned, how VMSG supports that. Before I move on, though, I want to say that, one, there are other software out there, and some that are probably better than VMSG. I've looked at a few of them. And the state has their own programs. You know, I think of environmental health, I think of EHIPS and SIDWIS, right? These EHIPS is Environmental Health Information Processing System, I think. SIDWIS is the State Drinking Water Information System. Regardless, they keep track of the work that is being done. Essentially, a performance management system keeps track of the work that is being done. And if it's a good one, it can report back in a pretty easy way to management and staff on if the work is being done and how well it's being done. So that's what we have here. So VMSG, it's hierarchical. Remember, we've seen a lot of hierarchies in our presentation so far. It can be used internally and externally. It can be multi-organizational. It has the activity as a building block. Where have we seen that word activity before? That was in the 10 essential public health areas by the CDC. All of those were activities and tasks. We have 20 licenses. You know, we as a department are still learning how to use this, but it's a decent piece of software. So let's look at VMSG with regards to what we've learned so far. So you can store the vision, mission, values, services, initiatives, goals. Now, by the way, a goal is a vague statement pointing in the direction you want something to move. So we want to reduce obesity. Good, right? That's a nice goal. It's kind of vague. It's pointing us in a direction we want to go. That's a goal. That is not an objective. An objective is SMART again. Okay, one of the things we're going to do to reduce obesity is, not one of the things we're going to do, one of our objectives is to decrease the sale of sugary beverages in Cattaraugus County by 20% by the year 2025. That's our objective, right? That's going to help us meet our goal. It's SMART. That's our objective. And we're going to have activities that we're going to do to meet that objective. Okay. Oh, yeah, there's our activities. We know what those look like. We've seen those. Okay, so every group level in VMSG software can have those things. So here's how VMSG would organize something like the funnel of health. So in VMSG, the different organizations in the local health systems would be exactly that. In VMSG, they would be organizations. Then you have group levels. Cattaraugus County Health Department would be a group level 1. We're our own agency. So thinking about the local health system, we're one of those circles, right? Our administrative division is not necessarily synonymous with the health department, right? But it is a level 2, okay? It oversees our level 3 divisions with our division managers who head those up. And we may also have programs within divisions, right? And so that would be a level 4, and the staff work within those programs, okay? So what is this starting to look like, especially on the lower levels? It's starting to look like an org chart, and we're going to show you that. So here is the org chart, and excuse me, this is horizontal alignment levels and plans. Okay, big concept. All right, our community health improvement plan looks at aligning the actions of various agencies, right, across agencies, right? So this is across group level 2. Remember, the health department is only, or group, I probably should have put group level 1, group level 2, but the health department is just one agency in that. Then you have our strategic plan, which aligns across programs. So there's going to be certain services and things that occur across the health department. Those would be addressed by the strategic plan, okay? Certain programs may also have their own goals and objectives that may be dictated to them by New York State, or in the case of health care and the lab, their regulatory agencies that oversee them, or their internal processes, okay? So the strategic plan goals and objectives can come from those 3 different avenues, okay? And then the action plan, that's within group level 3, okay? And those are going to be programs and staff are going to generate those action plans, right? So, I got to meet 100% of my inspections for environmental health this year. That's the state objective, right? And I have to have an action plan to do that, right? Now, in many cases, in fact, I dare say most cases, those action plans just exists in staff's mind, okay? They aren't written out. Sometimes they are, and that's good. But they just exist in folks' minds, right? Supervisors and managers' minds and staff minds, right? What are my tasks for today? Anyway, these are things that work across. This is where we get horizontal alignment. These are the tools. The CHIP gets us alignment across organization. The strategic plan gets us alignment across divisions, and the action plan gets us alignment among staff, right? So here's an example of vertical alignment. We're going to use the path. We're not going to use the New York State Core Functions path. We're not going to use the home care path. Those are legitimate paths. They should be looked at. We're going to use the John Chip path, New York State Prevention Agenda, right? So, the CHIP Service Initiative comes from the New York State Prevention Agenda. It's prevent chronic disease, okay? That's something that New York State wants us to do. One of our goals in that also comes from New York State. It says increase food security. Look at that goal for a second. Vague statement points us in a direction, right? Increase, we're going to change something in a certain way. Food security, right? The CHIP objective, by December 2024, increase the percentage of adults who are food secure by 5%. Okay, very smart, right? There's a date in there. It's reasonable, relevant, timely. Okay, very smart. It's measurable. And how do I know it's measurable? I know New York State collects that kind of data um, through something called BRFIS, which a lot of you probably don't know, but they collect that data. So this is all across level 2 groups, right? So the health system works on this. Now, going down to the strategic plan level. Remember, strategic plan goals and their objectives can come from those 3 different sources. One of them might be to simply support CHIP implementation, right? So we had a job, the health department had a job that got designated to us in the CHIP. And that job had to do with we're going to help increase screening for food insecurity to support this CHIP objective, right? So how are we going to help out? Well, we're going to help out. Our objective is that by December 2023, we're going to assist in establishing food insecurity screening workflows in 5 partner agencies. So, social service agencies, we're going to go out and we're going to work with them, look at their workflows and figure out how they can best screen their clients for food insecurity. Okay. Who's going to do that, right? I mean, that's unfortunately right now, a lot of things get put onto our health education staff for these kind of things. They're the only ones who don't really have other demands on their time from New York State with the New York State core services, right? They're kind of they're kind of a freebie, if you will. They're not tied to New York State programs quite as directly. All right, action plan. So then we have, okay, our actions are going to support the strategic plan implementation. We're going to identify an easy to use screening instrument. That's our goal, right? Again, very general, right? By September 2023, we're going to review at least 3 known screening instruments and receive comment from implementing agencies. Okay, good. So, again, that's kind of smart, right? There's a date there, there's measurable, right? We know we got to hit 3 of them. If we only hit 2, we didn't meet our objective, right? And that is our action plan and service initiative. And this is what the staff actually do, right? So the staff go and they figure out in their heads and the tasks and skills that they know, they figure out how to meet that objective. Okay, so a lot of us are working down at the action plan level. And again, the action plan doesn't need to be written. Okay, it can be. Some might argue it should be. It could go into something like VMSG, right? But it is formulated by directors and supervisors with staff input. It is stored within each division as a service or initiative, right? So that's happening within each division. They may have their own goals, objectives, and activities. If an action plan is pretty complicated, you might need to go to another level, an even more fine level. Excuse me, my dog is barking. All right, he stopped barking. These action plans are carried out by staff doing their daily and specially assigned tasks. The tasks are usually time sensitive. We talked about that. And in VMSG anyway, we don't have enough licenses to assign tasks to staff. So normally tasks get assigned to a manager or could get assigned to a manager, and that manager would basically remind the staff that the task needs to be done. Okay. So thoughts on accreditation in the Cattaraugus County Health Department. So I hope, so look, I covered a ton, right? I took you from, um, national level thoughts on essential, on public health service areas, on foundational public health service areas and capabilities. I took you from that all the way down to your daily tasks. And I've told you where accreditation and where key documents and processes and accreditation fit in, right? Um, and how I've described to you how your role doing these daily tasks and how you go about doing those daily tasks, where that fits into this whole concept of alignment, right? Um, and when we do accreditation, basically what the accreditation body is looking for is proof that we have consciously thought about these things and we have thought about how we are doing these things and how we are keeping track of how we are doing these things. That's a big one, right? They want documentation. Nobody likes providing documentation. It takes time. It's kind of a pain in the neck. But moving forward, we're going to have to do that. Excuse me, the dog is barking again. So I want you to know that accreditation affects the entire department, right? It affects everybody. It is not a group of 6 or 7 people with other people pulled in occasionally to provide documentation, right? So we can get all the documentation together so that we can submit it and get our logo, right? Yes, we do that, right? But ultimately, it is a process that we begin to understand how we do things and understand our role in all of this and how we can work to improve the way we do things. So there will be more on accreditation. I'll probably provide some more of these little presentations. I hope you enjoyed this one. Um, and I hope you don't mind sort of my free form style, but that's kind of like it that way.